Welcome. Today we are exploring multiple sclerosis, commonly known to us as MS. What is MS?
MS is a chronic disease that damages the nerves in the spinal cord, brain, and the optic nerves. Sclerosis means scarring, and people with MS develop multiple areas of scar tissue in response to those damages. Depending on where the damage occurs, symptoms may include problems with muscle control, balance, visual acuity, or even speech.
What are the symptoms of MS?
Nerve damage resulting from MS can cause one to experience weakness in an arm or leg, numbness or tingling, loss of balance, or painful muscle spasms. These symptoms may lead to frequent falling, tripping, or difficulty walking. More than half of all people with MS experience a vision problem called optic neuritis, which is an inflammation of the optic nerves. Optic neuritis may cause blurred vision, eye pain, loss of color vision, or blindness, usually in one eye. The problem is usually temporary and often improves within a few weeks. In many cases, vision problems are the first sign of MS. Although less common than vision problems, some people with MS develop slurred speech as a result of the damage to the nerves that carry speech signals from the brain. Some people may also experience difficulty swallowing. MS clouds our mental clarity, which can impact the length of time it takes you to solve problems. It can also affect your memory and cause difficulty concentrating or focusing. Most MS patients will experience some loss of bladder control. Fatigue is a common problem among MS patients. One may still feel tired even after a good night's sleep.
MS, or stroke.
Often, MS symptoms can mimic stroke. It's better to err on the side of caution. Should you, or someone you love, suddenly have trouble with speech or moving your limbs, it is best to go to the emergency room immediately. The earlier stroke is treated, the better the chances for a successful recovery.
Effects of MS on the brain.
MS attacks the body's own immune system and destroys the tissue, called myelin, that surrounds the nerve fibers in the brain, spinal cord, and optic nerves. MS causes scar tissue to form on these fibers, interrupting nerve signals. Myelin acts as insulator for the nerves and facilitates the nerve signals that control movement, speech, and other functions.
What causes MS?
The exact cause of MS is unknown. Most researchers believe it is an autoimmune disease in which the immune system attacks the body's myelin, causing a disruption in nerve transmission. However, researchers have been seeing some surprising trends, including MS is more common in colder regions, further from the equator, including Scandinavia and Northern Europe, and, since these areas get less sunlight, researchers believe that vitamin D may be directly related. Vitamin D is called the sunshine vitamin, and research suggests a possible link between the vitamin D deficiency and autoimmune disorders. Research also suggests that MS may be more active during the summer months, as heat and humidity may temporarily worsen symptoms. Genetics also appear to play a role in MS. The consensus among neurologists is that MS occurs in response to an environmental factor, which acts as a trigger for an autoimmune response to myelin in genetically susceptible individuals.
Who gets MS?
Women are twice as likely as men to get MS. Whites appear to be more at risk, but MS strikes people of every race. Chances of developing MS are highest between the ages of 20 and 50.
How is MS diagnosed?
First, a complete medical history and neurological exam are done to rule out any other causes for the symptoms. An MRI, or magnetic resonance imaging, scan will be scheduled to check for abnormalities of the brain or spinal cord. Disease-related changes in the brain or spinal cord are detected by MRI in more than 90% of people suspected of having MS. However, absence of scar tissue does not necessarily eliminate a diagnosis of MS. About 5% of people with MS do not have visible lesions that show up on the MRI. A spinal tap, or lumbar puncture, identifies abnormalities in the fluid from the brain and spinal cord, indicating that the body is attacking itself. Evoked potential tests measure electrical activity in certain areas of the brain in response to stimulation of certain groups of nerves. While there are no specific lab tests to diagnose MS, tests that generate abnormal results are helpful in diagnosing or excluding the disease. Lab tests are also used to help rule out other autoimmune conditions or infections.
The 4 phases of MS.
MS follows a different pattern for each person. With appropriate treatment, many people successfully manage their disease. Patients are classified into one of the following 4 defined forms of MS. 1. Relapsing remitting, characterized by attacks followed by partial or complete recovery, called remissions. This is the most common type of MS at the time of initial diagnosis. 2. Primary progressive, a rare form of MS with a slow and nearly continuous worsening from the onset. There are no distinct relapses or remissions. 3. Secondary progressive, following an initial period of relapsing remitting disease, the disease becomes progressive with increasing levels of disability in most patients. This occurs 5 to 25 years or more after the initial diagnosis. And 4. Progressive relapsing. This rare form of MS is characterized by a steady worsening disease from the onset, with clear, acute relapses.
How is MS treated?
Disease-modifying medications help reduce the frequency and the severity of MS flares. Proper use of medications results in less damage over time, which slows progression of the disease and disability. When a flare does occur, high-dose corticosteroids can help shorten it. There are many medications available for managing symptoms such as muscle spasms, incontinence, and pain. Nearly 50% of MS patients will develop some pain, either as a result of destroyed circuitry in the nervous system, or because of strain, or muscle spasms. Anticonvulsants and antidepressants have shown to be effective in easing nerve pain. Physical therapy helps you learn how to compensate for loss of coordination, balance, or muscle strength. Exercise is effective for strengthening your muscles, reducing stiffness, and maintaining mobility. Careful though, overdoing it can make matters worse. Ask your physician to help you develop an appropriate exercise plan, and then start slowly. Water aerobics, swimming, and stretching exercises are the best. Other types may include yoga, tai chi, cycling, or other low-impact aerobics. In occupational therapy, a treatment plan is tailored to your needs, which helps you retain or regain your hand coordination. And speech therapy may be beneficial if you are having trouble with speech or swallowing.
MS and pregnancy.
Generally, it is considered safe for women with MS to get pregnant. Be advised though, that in the first few months following delivery, the odds of a relapse may increase. Be sure you discuss your desire to become pregnant with your doctor, as certain MS medications should not be used while pregnant or nursing.
Managing your mobility.
While the majority of MS patients are able to continue walking, some type of assistive device may be beneficial. Orthotic shoes or leg braces increase your stability, reducing the risk of falling. If one leg is not as strong as the other, the use of a cane will help give added strength to the weaker side. Those with significant weakness or instability may need a walker or a wheelchair to assist with mobility. Using an assistive device helps you live a full and rewarding life, and does not indicate a weakness or a character flaw. Discuss mobility problems with your physician to determine the best course of action.
Home modifications.
Making a few minor changes in your home can help you manage your daily activities and keep you safe. Most importantly, lose grandma's throw rugs. It's very easy to trip or slip on them, and you could be seriously hurt. Install safety grab bars inside and outside your tub or shower. They will help stabilize you. You may benefit from a shower chair. Look for one that accommodates your size, weight, and facilities, and one that you feel safe using. For these common assistive devices, check your pharmacy or a medical supply store. Some department stores also carry a limited selection.
Living with MS.
With the advances in medicine and ongoing MS research, patients are now able to keep their disease under control or in remission for a significantly longer duration. This is good news for those diagnosed with MS, as you are able to retain your independence much longer. If you are having difficulties living with MS, you can benefit from cognitive behavior therapy or CBT.
We hope you enjoyed this presentation. Please look for our other information videos.
For more information, visit us on the World Wide Web. Chronic pain and depression. www.pain-and-depression.com